The first week of September is dedicated to National Kidney Awareness to educate, advocate for kidney health. I am joined by Moses Habimana, who's the Regional Manager of Care Coordination at Life Healthcare. Moses, great to have you on the program this afternoon. Can you firstly explain the significance of National Kidney Awareness Week and why it's important to even highlight kidney health at this time?
Right. Good afternoon, Nhlanhla, and good afternoon to the viewers at home. I think just like you highlighted, at the beginning of each September each year, we sort of try to go back to our communities and highlight the importance of actually understanding what the kidney does in one's body. And of course, if we don't take care of our kidneys, what actually then happens thereafter. I must just maybe also highlight to you approximately about 844 million people globally are usually sort of diagnosed with chronic kidney disease as well.
But what are some of the most common factors contributing to chronic kidney disease? And how prevalent is this issue here in South Africa specifically?
Right, that's a very good question. One thing I must just also then highlight is, of course, as we've sort of seen over the past couple of years, a lot of the more chronic conditions we call high blood pressure, sugar diabetes, and so on and so forth, have been one of the biggest contributing factors to chronic kidney disease. In particular, not managing these particular chronic conditions has sort of resulted in us sort of seeing what we are seeing now as Life Healthcare, of course. Of course, one other thing is a lot of patients, loved ones, communities also don't understand the importance of following annual checkups and sort of a culture of following that. You go back to your doctor, your nurse, your clinical associate, for example, and sort of then ask, what does this actually mean for me on a year-to-year basis?
Maybe let's speak to how Life Healthcare addresses kidney health and chronic kidney disease through your care coordination programs. Are there any specific initiatives in place?
Absolutely. As we've seen, like anything else, healthcare costs have been going up and up. But at Life Healthcare, in particular Life Renal Dialysis, we believe in sort of keeping the patient at the center, at the core of everything else. I'll make an example, and I'm sure maybe the viewers at home would also be quite familiar with what I'm about to say. Usually sometimes we go to our doctors will highlight a diagnosis, for example, and unfortunately we go in one ear and go out the other ear. And sometimes we've seen across time, especially within chronic kidney disease, this results in unexpected sort of admissions and sort of a decrease in quality of care. So at Life Renal Dialysis, under Life Healthcare, what we've done is sort of create a program where we bring a multidisciplinary approach by introducing this care coordinator who's essentially there to sort of keep the patient at the core, handhold this patient, be there for the patient emotionally, educate the patient in regards to what they have to do at the right time, at the right level. I think one of the things that, of course, you would know as well as the viewers, sometimes our patients don't always know where to go at the right time. And this care coordinator essentially is that person to handhold. And also, ultimately, by doing this correctly, Life Healthcare is able to demonstrate value for the patient and increase the quality and outcomes that they receive at any given time on their renal journey.
I want to take the words of Dr. Siobhan Clark of the National Renal Care. She's emphasized the importance of the BALANCE acronym for kidney health. How does Life Healthcare then incorporate similar strategies in patient care or even education, if you will?
Absolutely. That's a fantastic question. We know, as I highlighted earlier on, that sometimes there is a fragmentation of care, right? A doctor will will do what they have to do, a dietitian will do what they have to do, and so on and so forth. What we do at Life Renal Dialysis is we bring everyone together. And we then put the patient in the steering wheel and say, this is what this particular person at this time has to do for you, and then educate them on the importance of following up and doing what they have to do at the right time. So we are very much in agreement that our patient is at the core, and we sort of try to take away the fragmentation of care and put the patient at the center.
So Moses, with the increasing prevalence of chronic kidney failure as well, how dire would you say the disease is globally and in South Africa? And what are some of the key preventative measures that individuals can take to really protect their kidney health?
Yeah. Again, great question. So one of the big contributing factors, as I highlighted earlier on, is unmanaged or uncontrolled sort of sugar diabetes, or what we call high blood pressure. We've seen that a lot of our patients who are unable to control them long term usually then end up with chronic kidney disease, unfortunately. And this is obviously because of how some of these chronic conditions will affect your body, right? And so what we do with the help of these care coordinators that we have at Life Healthcare is really try to enhance the quality of education and understanding of these particular chronic conditions. But of course, chronic kidney disease does not necessarily mean that you have to have diabetes or high blood pressure to get it. But usually we have seen that usually if you have uncontrolled sugar diabetes and high blood pressure, you're more likely to have sort of chronic kidney disease as well.